Greetings to everybody. I'm Dr. Ganesh, gastroenterologist, hepatologist, interventional endoscopist from SG Gastrocare, Coimbatore, New Siddhapadur. I'm going to talk about a very important liver disease and also which is increasing in number and incidence in India. It's none other than viral hepatitis and also the cirrhosis. So what do you mean by viral hepatitis? It's nothing but injury of the liver by virus. We know that after the COVID pandemic, a small virus can create a major havoc or damage to the body. Similarly, the unnoticed one, the viral hepatitis producing virus, hepatitis B and hepatitis C virus. A lot of acts have been put into practice by doctors and social activists to reduce this virus spreading to the body, either by vaccination or by educating the people as a preventive measures. So why do you need to worry about this viral hepatitis? After all, it's a small virus. Because this virus, B and C virus, settles in the liver, multiplies without you knowing that the virus has entered the body. So there is a constant damage, continuous damage happening to the liver. So the liver heals by scarring. Whenever there is an injury, the whole body heals by scarring. So when there is a lot of scarring happening in the liver starts shrinking and you end up in a problem called cirrhosis, which requires either liver transplantation or you succumb to cirrhosis due to complications like ascites, blood vomiting, hepatic coma, and recurrent infections and death. It all doesn't happen within one day after the virus entering the body. It takes few years, maybe 10 to 15 years or 20 years for the virus to multiply and cause the damage from the point of entry to the point of cirrhosis and complete damage of the liver. So how does this virus spread? So why is it so alarming? It spreads through the blood, mainly if you use unsterilized needles, medical equipments, or blood which is not carefully screened for this virus and blood contaminated with this virus injected into the body, or it's through husband and wife relationship, and also it can be transmitted from the mother to the baby during the delivery. So there are three ways where there is the contact of the blood to the human body, the virus spreads. So if you are careful in these three areas, you can prevent this hepatitis B and C virus entering into the body. Most of the time, we may not know that the virus has entered into the body and causing the damage. There will be non-specific symptoms like body pain, tiredness, weakness, joint pain, right upper quadrant abdominal pain. So these are the few symptoms these patients can have, or they may not be having any symptoms at all. Most of the time it is detected during the blood test programs where you do a mass cell checkup and your doctor finds that there is some abnormalities in the liver test which has been taken and he recommends you to see a gastroenterologist. So when you do hepatitis B or C virus testing in the blood sample, then we can find out whether you are suffering from B or C virus. The B virus is completely preventable, especially by doing vaccination, because we have an excellent vaccination to prevent the hepatitis B entering into the body. So these can be administered to prevent the hepatitis B, and also hepatitis C, we don't have any vaccine at present, but by preventive measures we can stop the virus entering into the human body. So if at all if the virus has entered into the body, we have to check how many virus are there multiplying by special tests and then treat appropriately using antiviral medications, especially for hepatitis B and also for C. Nowadays we have oral tablets which are much more efficient and 100% curing hepatitis C virus, and B virus also. We have excellent newer drugs which can control and reduce the viral load of the hepatitis B and prevent the complications of the virus, because this virus continuously damages the liver, as I told you earlier, leading to cirrhosis, liver cancer, liver failure and transplantation. So by preventing and becoming aware about this virus, regular blood testing for SGPT, SGOTs, or screening camps where we do hepatitis B and C virus checking, this virus can be identified and cleared from the blood as early as possible before it damages the liver. Thank you very much.